checking for type 2 diabetes the right way. The purpose of regular blood sugar testing is to help people with type 2 diabetes control blood sugar levels. However, many patients still do not know when to check and how often to ensure health. When you have the disease, your pancreas is still functioning normally, but the blood sugar is not converted into energy for the body to use. Blood sugar testing is essential for people with diabetes. Check your blood sugar regularly. A recent study published in JAMA Internal Medicine concluded that 14% of patients with type 2 diabetes were checking their blood sugar too often. This is a matter of debate in the diabetes community about how often people with type 2 diabetes should have their blood sugar measured. 3 of the diabetes-related medical associations, the American Academy of Family Physicians, the Society of General Internal Medicine, and the Endocrine Society, are now encouraging patients to check their blood sugar less. This creates contradictions in previous patient education efforts. The results of this study can be misleading for many diabetics, making them think they don't need to check their blood sugar as often. However, this is still considered an important part for people with type 2 diabetes. In fact, blood sugar levels are not fixed all day, but fluctuate based on the amount of carbohydrates, fats, proteins, drugs you use. Therefore, you need a blood glucose meter, test strips and equipment to be able to assess daily whether you are controlling your blood sugar effectively or not. Regular blood sugar testing depends on your health status, treatment effectiveness and daily needs. Most people with type 2 diabetes should measure their blood sugar at least once a day. Some people may need to be tested more often depending on their medical condition. Time to check blood sugar is appropriate. Patients with type 2 diabetes should schedule blood sugar checks to suit the times of day. Routine blood glucose testing may include before 3 meals a day, after exercise, at bedtime. Testing before meals is important because fasting blood sugar shows you how effective the treatment you need is. If you choose to test after a meal, you should wait 1 to 2 hours to make sure you get an accurate blood sugar reading. Change your regular blood sugar testing schedule. There are many possible reasons why you might change your regular blood sugar testing schedule temporarily or permanently, such as your overall health. If you feel unwell, you should increase the frequency of your blood sugar testing until you feel better. Blood sugar. You start to have high or low blood sugar more often. Your doctor may want you to do more tests to determine the problem. Physical activity. If you plan to increase your physical activity more than usual, you should check your blood sugar before doing so. Effective treatment. If you have successfully treated your diabetes for a long time, your doctor may allow you to reduce the frequency of blood sugar testing. As with most things in life, your blood glucose monitoring schedule shouldn't be too rigid. You should check your blood sugar based on your needs, disease and physical condition to maintain a stable health. In particular, do not forget to carefully record the monitoring indicators to discuss or ask your doctor at your follow-up visit.